name is Dr. Kevin McGraw. I am an interventional radiologist with Riverside Radiology and Interventional Associates. The field of interventional radiology is a subspecialty of diagnostic radiology that uses imaging guidance to perform minimally invasive procedures. There's an entire array of minimally invasive procedures that we can perform. Within Riverside Radiology and Interventional Associates, we have the largest private practice interventional radiology service in the country. We have 9 board-certified peripheral interventional radiologists, as well as 4 board-certified neurointerventional radiologists. Interventional radiology is a subspecialty of diagnostic radiology where procedures are performed with minimally invasive techniques. Basically, it's postage stamp surgery, if you will. There's less recovery for the patient when things are done through a tiny little puncture as opposed to open surgical procedures. In addition, there's significant reduction in the amount of time patients have to stay in the hospital for a certain medical procedure. There's also significant cost savings to the healthcare system when patients can be treated with interventional techniques as opposed to open surgical procedures. One example, patients who may have a condition known as fibroids of the uterus traditionally would have a hysterectomy procedure, which would require several days in the hospital as well as almost a month off from work. Well, currently with interventional techniques, we're able to use a small catheter to insert it directly into the arteries that supply the uterus and inject tiny particles to shut down the fibroid tumors, causing them to shrink. The patients go home the next day and everything is done through a tiny little puncture in the groin that can be covered with a Band-Aid. At our outpatient center, we're able to perform a wide variety of procedures that do not necessarily require the care that you receive at the hospital. We're able to treat patients with pain, conditions of the spine where they may have spinal pain or a compression fracture. We're able to do vertebroplasty and kyphoplasty on the outpatient basis. In addition, we treat a large number of patients with painful varicose veins using state-of-the-art laser techniques to seal the problem veins shut. Our interventional neuroradiologists perform procedures that involve the carotid arteries as well as the brain. They do treatment for stroke as well as aneurysms in patients. Peripheral interventional radiologists basically treat almost any disease process from the neck down. We do vascular interventional radiology as well as non-vascular treatment. Within vascular and interventional radiology, we treat diseases of the arteries as well as the veins, including treatment of patients with hardening of the arteries, with leg pain from atherosclerosis. We do balloon angioplasty and stent placement. If patients come in with blood clots in their leg veins, we can dissolve those clots using catheters and guide wires. Also, we treat patients who have varicose veins using state-of-the-art laser ablation techniques. We treat oncology patients, patients who may have a tumor of the liver or the kidney. We are able to use CAT scan guidance or ultrasound guidance to place a probe directly into the tumor and either freeze it, killing the tumor cells, or using radiofrequency to heat up and kill the cancer cells. In addition, we're able to treat tumors throughout the body using catheters to go into the blood vessels supplying the tumors and injecting chemotherapy drugs directly into the small blood vessels, specifically supplying the tumor. Our Neurovascular surgeons are a key component of the Ohio Health Neurovascular Center, which is a comprehensive stroke center within Ohio. We service a wide region within Central Ohio for patients who have neurovascular conditions. In addition, we treat a whole variety of conditions of the spine. Patients who come in and have back pain, there can be many reasons for them to have the back pain. We're able to diagnose that reason using MR imaging or CAT scan, and then target our treatment using CAT scan guidance or X-ray guidance to do a nerve block procedure or another treatment modality. Some of our patients suffer from compression fractures of the spine due to weak bones or tumor. When the bone compresses down, patients are in excruciating pain. So now, using interventional techniques, we're able to use X-ray guidance to place a needle into the bone that is broken, inflate a balloon to re-expand that compressed bone, and then fill it in with a medical grade cement to stabilize the fracture on the inside, alleviating pain. These patients are then able to walk out of the hospital virtually pain-free. In addition, at our Lewis Center location, we're able to do filter placement for patients who may have blood clots in the legs, and we're able to place a little filter device to catch those clots before traveling to the lungs. We're able to do that very safely and effectively on an outpatient basis. In our patients who have an IVC filter that is no longer needed, we are able to safely remove it using X-ray guidance and a small little lasso device, and it's performed very easily within 15 or 20 minutes at our outpatient center. Many of our patients that we treat have painful, unsightly varicose veins. And the reason they have the varicose veins is due to faulty valves within a large vein that runs down the thigh. Traditionally, patients had to undergo a painful procedure to strip out and surgically remove the vein that had the faulty valves. Currently, at our Lewis Center location, we're able to use a laser to go inside of the vein that has the faulty valves and heat seal the faulty vein shut. By sealing that vein shut, that takes the pressure off of the varicose vein branches, alleviating the patient's symptoms as well as the unsightly varicose vein appearance. When patients have varicose veins, they often have symptoms. Those symptoms will allow us to treat them with our minimally invasive techniques, and most insurance companies will cover the procedure since it is medically necessary. Within Riverside Radiology and Interventional Associates, we have a very collaborative team approach to patient care. Not only are we collaborating with our diagnostic radiologists, but we also work very closely with other physicians of different specialties at Riverside Methodist Hospital to provide the best care possible for our patients. Riverside Radiology and Interventional Associates has one of the largest private practice interventional groups in the country. Not only are we expertly trained, but many of us continue to provide state-of-the-art image-guided procedures. We are always looking for the newest techniques to provide our patients the treatment that they deserve. Many of us have published extensively on different conditions treated by interventional techniques, as well as published textbooks on the field of interventional radiology. We are currently attending meetings and collaborating with other interventional radiologists across the country to learn and advance newer image-guided treatments for our patients. Our Lewis Center location is very convenient for patients, and many patients will choose to have their procedure performed at Lewis Center when possible. The parking is directly in front of the building. There's a great lobby and waiting area. Patients will be greeted by an expertly trained staff that are very customer service oriented. As an interventional radiologist, the thing that excites me the most is being able to provide minimally invasive, targeted treatment for a variety of conditions that my patients suffer from. Patients are able to go home right away without a lengthy hospital stay and have a better recovery after the procedure.